Welcome to another episode of Your Faith and Health Community. I'm Pastor Jackie Jackson, your host. This is the show that explores all the different things you need to know about your faith and especially about health. I don't mean explore about your faith. Hopefully you already know what that is. But to talk about faith, talk about health. And when you really think about it, faith and health goes together. Because when you talk about faith or you talk about your spiritual life, you're talking about something that's holistic. And how holistic can you be if you don't have your health in order? Not meaning that if you get sick, that's an issue, but you want to try to prevent that. I also want to mention that November 1st started the open enrollment. So if you have not enrolled in healthcare, meaning Marketplace, the Affordable Care Act, some people call it Obamacare, November 1st started the first day to get enrolled. If you didn't enroll last year, then you are going to be faced with a fine or possibly faced with a fine when you do your income taxes of $695 per person in your household that you claim on your income tax. So just so that you're not confused, it's not just $695. It could be a whole lot of money. So you want to make sure this year that you get it done. All right? You have until January 31st to get enrolled. So reach out. You could go to www.healthcare.gov. They have people to speak to you in over 130 different languages. So get it done. Don't wait. And besides, the amount of money that it'll cost you for one visit to the emergency room, you will have taken care of your health care and been able to go out and buy some healthy food. All right? So let's talk about this show. We have with us, and I'm very excited about this, we've been waiting to get these individuals on here for a while. We have with us Dr. Jean Anthony, who is the Associate Professor at University of Cincinnati College of Nursing. And we have Dr. Edie Morris, who is the Research Associate at Cincinnati Children's Hospital. So we have a wealth of information. I'm going to stop talking just to you, and we're going to jump in and speak to them. How are you all doing today?
Okay. Well, thank you.
All right,
Thank
great.
you.
Thank you for being on here. And I want to jump into this because it's important. We want to talk about mental health. And I know just from being a pastor, from just being a person, that when you think mental health, people have a tendency to shy away or all the different feelings about it that are actually keeping some people from getting the help that they need. So since I have the professionals here, why don't you explain or talk about mental health from your perspective for people so they can get a good idea of what it actually is?
Well, mental health is, I would describe it as that sense of kind of a holistic, that sense of well-being, your ability to manage your life in a positive way, to take care of yourself, and complete your activities of daily living in a very positive way. Would you kind of agree with that?
I would agree with that, Dr. Anthony. I think it's about being happy and satisfied with life and generally just feeling good about yourself.
Yeah. Mm-hmm.
And that makes sense. But now also to explore, we know that from a pastoral standpoint, and especially in the area where our ministry is located, which is down in the West End, there are a lot of people in our daily journey that we run into that are having some mental health issues, that are not happy, that are not having a prosperous life. And so they're dealing with some issues. So we know that there are, I don't want to say two sides of the coin where it is, but there are some people that are going through mental health issues, don't even realize it, depression. And sometimes, I think when I speak to people, the first thing if you say mental health, they go, I'm not crazy.
Yeah.
And it's like, you're right, you're not crazy, but there is something going on. So can we just talk about that a little bit so that whether it's a person that's watching that may be going through some kind of mental health issue, whether it's depression, or it's a family member that's noticing something about a family member and not sure how to take it, the different changes in their routine, their eating or sleeping habits.
Well, there's such a stigma regarding mental illness in this world today. People see it very negatively. There are lots of myths about mental illness. People really don't understand it. So the stigma and the lack of understanding, I think, are tremendous. and play a huge role in individuals seeking help. You know, they don't want to be labeled as crazy, okay? They don't want people to feel that this state of health that they're experiencing is contagious. You know, they don't want to be avoided, isolated, and sometimes they don't want to really hear that they have a mental disorder. You know, no one wants to hear that because in many instances they feel less about themselves, and so they will avoid seeking help. But that certainly is not the best thing to do. The best thing to do is to seek help when you need it, and that way probably the symptomatology is less, and your recovery generally can be much quicker if you seek help when you recognize that you're having some symptoms. And that really encompasses any mental illness. And if you notice that someone in your family or in your environment is behaving differently, you may want to approach that individual and help guide them to a source of care so that they can get the help that they need. I think that's very important. You don't want to shy away from it. You really want to, I'm going to say, run to it and help people get the help and care that they need.
Okay.
One thing that I would add to that, and I think you brought this up, and I'm glad you did, is environment. Environment has a lot to do with how we feel about ourselves. And by environment, I'm not just talking about the actual living environment, but the people you work around, you know, things going on in your family. There's so many external things that can cause you to be depressed. And you think you need to be strong and get over it. But a lot of times you just really need somebody to talk to, first off, and somebody that can hear you. So it's always good to get help, even if you think it's not that big a deal, because it can be.
And that makes a lot of sense. And I think especially, I don't know from your side of the fence that there makes a difference, but you know, for men, we have a tendency, I mean, even if it's hitting, you crack your foot on the table and you know, I'll be okay, I'll walk it off, as opposed to going to get help. Do you see that there's a difference with men versus women in terms of seeking help?
Oh, sure. I think women by nature and by socialization are much more readily tend to seek help for a variety of different illnesses. And depression is a medical illness. Even though the symptoms usually present themselves behaviorally, it is a medical illness, it is a treatable illness. But you know, we live in a society where men are expected to be more macho, to kind of, if I can use the term, suck it up and deal with it. Men don't get depressed, you're the providers, etc., you know, go on with your life. And we really need to dispel that myth, because anyone can experience depression based on the environment and what's going on with their lives, because it is a medical illness. Again, it is treatable. Okay? But yes, we do tend to see depression more frequently in women, but I'm actually not so sure that the rates are that different. But it's just that men don't tend to come forth as readily as women seeking help for depression, and men may complain more of physical symptoms, you know, headaches, abdominal kinds of issues, things like that, as opposed to women maybe talking more about how they feel emotionally.
Okay, yeah, and that's the same for men, even from anything. We may complain that, oh, my side is hurting, but the minute you say you should go seek help, it's like, oh, no, it'll be okay, I'll give it a few days, I'll walk it off, you know, but that comes from, that's what we were taught. You know, you don't cry, you don't, you know, I remember I was speaking to someone, and it was a guy, and he said, well, you know, I don't get into that, you know, talking about depression and all that, I don't get into that. And he made the comment, he said, guys like us, we understand how to navigate. So I went ahead on, I said, let me share my story with you. I said in 2012, the summer of 2012, I went through depression that I went from weighing 275 pounds to weighing 220 pounds between mid-May and mid-August. So that was a lot of, now I enjoyed the weight loss after I got over the depression, but that was a lot to lose. And I talked about, said I got all the way up to ready to kill myself. I said, so guys like us, I'm not sure that you're talking about guys like us. And that we as men need to, for the benefit of our family, that we need to be more concerned with that. But I don't want to just harp on men. We get beat up all the time, so I'm going to leave us alone, guys.
I would just like to, I'm sorry.
No, so
That adolescence, which has been largely my experience, they present very different with depression than either men or women do. And so, and the most common thing that I have seen is irritability. They just are really irritable, or their grades drop. So if you see something like that in an adolescent, any change in behavior, crankiness, just impatience, grades dropping, weight gain is another big one in adolescence. Any of those kinds of things that you might see, they present really differently than adults do in adolescence. And so sometimes you get it. You're a little blindsided because you're really not looking for depression. You're looking for depression symptoms, but that's not what you see. You see something kind of different.
Right. So, and I'm glad you brought up that, because you're a researcher at Children's Hospital, so obviously it's dealing with children. I think some of the things that you hear from parents, even if they assume something may be wrong, is I don't want my children bogged down with all kind of medication, and so sometimes they're afraid. And I also think it's a cultural thing, depending. I know I'd always heard that African American or Black, we don't go, we don't seek psychiatric help or psychology or psychiatrists or whichever direction. But I'm going to say that the one thing I found in 2012, Dr. Chantel Thomas, a Sound Mind Counseling, which is a phenomenal place. If you need to go, male, female, I don't care, young, old, she's somebody to talk to. But when I started talking with her, what I found was I didn't lay on the sofa. It wasn't television. I didn't lay on the sofa. She didn't have her leg crossed with a pet, asking me. She did ask questions, but what it was is we more or less talked. We talked through some things. Some things she gave advice. Some things she asked me, well, what do you think is the issue? Or how do you think you might be able to move through it? But I think people are afraid of getting, especially for their children, getting medication, and then they no longer perform like their children do. And so that becomes a fear. Is that something that you all see run into a lot?
Well, I'd like to add to something to what Dr. Morris said about adolescence. Adolescence is a period of turmoil in some respects and change, for normal turmoil and change for adolescents. And they're hot and cold. That's how I describe them. Today, they're lovey-dovey, and 20 minutes later or the next day, they don't want parents in their rooms. They don't want parents to talk with them. Parents are the worst people in the world. It's kind of that back and forth. Parents sometimes see that, and they see it, the persistence of that, not eating, the irritability in their adolescence, and they attribute that to normal growth and development. But it's the persistence. Normal adolescents are irritable maybe one day, lovey-dovey the next. But if they're persistently irritable, if they're persistently not sleeping, if there's a persistence to the overeating, then you need to be concerned, because those are patterns. And those are clear patterns, clear signs of clinical depression. So I think parents need to be aware of that. It's the persistence. When you see the patterns that, then you need to be concerned about your child and try to have a conversation with the child to find out what's going on in his or her life, because children often don't have the maturity to handle some of the everyday issues and problems. And, it's tough being a kid today, tougher than it was, I think, when I was a kid. At least I like to think so. But to try to have a conversation and always build that relationship where children can come to you with whatever is going on with them. And that's not easy to do, but I think it's important because kids need a sounding board, an objective sounding board, so that they're not judged, but they feel that they can come to parents with anything that's occurring in their life that's troubling to them. And if it's troubling to them, they react to it, regardless of how we as a parent might perceive it. It's how the individual perceives it and how they react to it that is really the issue. And we need to be open to that.
Okay, and it seems like some of the same symptoms for adults are going to be the same for children, but that there are some things that break off.
Yeah.
What should, I'm going to start with for the youth and then come to you, Dr. Anthony. What should a parent be looking for? And I know you mentioned the irritability, but is there something else that might trigger to them that, hey, this is at least worth exploring?
Adolescents are also different, and even younger children who get depression. And so it's really hard to say that there's one size fits all, so to speak.
Right.
So I always explore changes in behavior. If they've been happy-go-lucky, everything's going well, and then all of a sudden something changes. And as Dr. Anthony says, that change persists. Or you feel like you can't communicate with them, like they're shutting you out, like they spend a lot of time in their room, and they don't want to talk about anything. Or if you try to approach something with them, they kind of get they bite your head off. And some of that is normal, but if it's consistent and you feel like you're not able to really communicate with them anymore, that's when there really is a problem that you start to notice that you should really be aware of and seek help. And sometimes it's hard to get them to go to see somebody because they'll tell you they're fine.
Right.
They're fine. So it's for parents, it's not an easy, it's very difficult to first recognize something and decide that you need to do something, and then to actually be able to do it. But if they have good health care providers, primary care is a great place to start, because anybody who deals with adolescents is going to be able to do that beginning initial frontline stuff before they actually see a psychiatrist or somebody who's specialized in psych.
Okay, so let's say the parent has been paying attention. They suspect or feel something's going on, and so now they've watched. Well, I guess this is actually a twofold question. One, where can a parent go get information? Because information is important. So if you know what you're looking for, or if you at least have some type of, not go to college and take a college course, but where can they get information if they're suspecting? And if they get the information, they're following or looking at it, and then say, yeah, we need to do something, what should they do? What steps should they take? I know that was two things. I like to be difficult.
I think a good place to start with solid information, because you want reliable stuff, and the internet is loaded with stuff, which some is good and some is not so good. I think a good place, if you have a really good relationship with your family doctor, I think that's a good place to start to ask for information. Somebody that you trust, somebody that's reliable. And certainly you can look on the internet, and you can look in books, and you can pick up pamphlets from mental health agencies. Sometimes what you really need is somebody to talk to you, and you can even go in and see the child's physician without them with you, just to try to get information about what you might be looking at. And the second part of your question was, I don't remember.
Oh, just how can parents educate themselves?
That's how I would do it. I would
Okay, so
say.
that would be, so it's both. The
yes.
answer, both answers, both questions are answered by the same thing.
I believe so.
And that's pretty good. That's good.
Yeah.
Dr. Anthony?
And I think that Um, Approaching your primary care provider, your family physician, is an excellent first step. Many times it may be important for the child to have a physical examination because, you know, adolescence is a period of experimentation, you know, and kids share different things and don't always say this pill is for this, you know, but they share. And how might that impact the child, maybe in a negative way? The fact that the child is growing and their hormonal changes, you know, may lead to different behaviors that may appear to be depression, but maybe may have a medical cause. So it's always good to approach, I think, the physician and allow the physician to assess the child before we make a diagnosis of depression, even though we might see some signs and symptoms that suggest that. I think particularly with adolescents, but we might say the same thing about adults, you know, because there's so many factors, different diseases, some medications, can lead to the presentation of symptoms that look like depression, cause the individual to behave as if they're depressed, but it might have a medical or an organic cause. So I think the medical piece is very important. That assessment is really key. That's what I think, you know. And in terms of signs and symptoms that we see in adults, I mean, it's very similar. I mean, we see the sadness that persists. We may see changes in appetite. The individual may overeat, or they may lose their appetite. They may have difficulty falling asleep. They may find themselves falling asleep fairly easily, but waking up early in the morning and not being able to go back to sleep. There may be changes in the level of concentration, that irritability. So some of the same symptoms we may see in adults, but again, it's the persistence of those symptoms that really we become concerned about, because everybody gets depressed, everybody feels sad at some time in our lives because things happen. Maybe you're faced with an illness and that's kind of shocking to you. You may be depressed, you may lose a job, you may lose through death a loved one. For young people, loss of a friendship, girlfriend, boyfriend, things like that. But generally, after a few days, we begin to bounce back. With clinical depression, we wouldn't see that bounce back. We wouldn't see that recovery. And that's when we need to be concerned, I think.
So let me ask you this, in either one, whether it's adolescents or adults, are there any situations where there are absolutely no symptoms? Can you be depressed and there's no symptoms?
Well, you know what? I think that's a good question, and I don't know, but I will say this, that people are very good at hiding their symptoms when they sense that something is wrong, for which someone might tell them that they need help, or they may sense that they need help, and if it's mental health, they don't want to deal with that. So people will cover that, you know. And I say that because suicide is associated with clinical depression in many cases. And I've known cases where situations where people have committed suicide and people have said, well, I didn't see it coming.
Right.
There were no signs of depression. Sometimes we look back at the person's life and we do see those signs, but sometimes we don't see that, you know, and we just wonder what happened. Well, people are very good at acting and covering up signs and symptoms, and we're not very good at asking the critical questions because frequently we don't want to hear it. We're afraid to hear it and what it might mean. So I think given those two types of scenarios, it can become problematic and we don't really notice the signs and symptoms.
Well, I remember, and then we're running short here, but I remember I attended, what was this, about 2-3 months ago, the workshop you all did around depression, and that was a very good workshop. And even from a clergy standpoint, and I've spoken with people, and I thought I was doing a good job in talking, but what was really great about the workshop is it brought more into focus questions that we need to ask, some things that you kind of skip over, some things that you don't pay attention to. And so is that something you'll be offering again anytime soon? And is it something that the public can come to for something of that nature? Or, because I think for me, just for my own mental health, for me as a clergy, and in my work that I do with the outreach, that was I got a lot out of that. Those two sessions, I got more than, I've talked about it a lot, more than you could believe for the time that we spent. Or maybe you would believe, you do it all the time, but I got a lot out of it. And it seems that would be something good if the community had something. I know you can go to their doctor, but if they had an opportunity to come together and see the demonstrations that you use, get that information, and get an opportunity to role play it even in the conversation. I think that would be good. Is that something, I'm not trying to put you on the spot, I'm just saying, is it something that may be in the working? Because the actors that you have that act out the different illnesses are really great. So,
well, you know, we hadn't thought about it to that extent, because right now we've been focusing on educating clergy about depression, because we know that so many people seek out their clergy when they have problems and issues. And we know that depression is a huge problem, not just in the African American community, but in society as a whole. Over 20 million people, adults, I'm talking about adults, experience depression in a given year. Now, we're not talking about the adolescents and the children, because we're now diagnosing clinical depression in children.
Now, how young?
It's a
when you
problem.
say children, how young are you looking at?
Well, I've seen children diagnosed as young as age 5 with depression, with depression. So this is serious. So I think that training people in the community is an important piece. We haven't gotten to that piece yet because we're still focused on clergy, but I certainly think it's important to continue to consider that and perhaps address that in the future. I see a lot of merit in that. I do.
Well, I personally think, just from what I received from it, I think that there are some parents, some husbands and wives and brothers and sisters that would benefit greatly. And there are a lot of people that really need help that may get the opportunity. I mean, even if it's, and this may sound crazy, but even if it's a store, a store that somebody frequents often, having that information, because as a community, or, if we as a community are looking out for each other, our health is going to be better, our faith will be better, just the community as a whole. So if you're going to Jim's store every day and Jim has some information and notices, wow, Bill and Mary, they're usually whistling, they're usually singing when they come in. And, now they're coming in and they're walking back out. That the more we know in the community, the better we'll be equipped to deal with this issue. And it is an issue, and it's not a negative issue in terms of how our mind perceives it. It is something, as you said, that most times are treatable, and especially if they're dealt with early. So we want to make sure that people know. Say information is important.
Yes.
So, look, fortunately we're out of time. I know we're going to get you back again, and I'm looking forward to it. But I thank you very much for coming out. So again, we have Dr. Jean Anthony, Associate Professor at the UC College of Nursing, and we have Dr. Edie Morris, who is the Research Associate at Children's Hospital, Cincinnati Children's Hospital. So we have two of some of the best hospitals in the world that are here with us today to give you information. So again, my name is Pastor Jackie Jackson. We want to thank you for watching Faith in Your Health Community. Join us again for the next episode. You never know what it'll be about, but I guarantee you it'll be about something that's going to make your faith and your health a lot better.